friends. Welcome to the daily update from the Aspen Daily News. My name is Oliver Sharp, joined today by John Anderson, Director of Pharmacy at Aspen Valley Hospital, as well as Amy Behrhorst, Head of Employee Health at Aspen Valley Hospital. Hello to you both. Thank you for being here.
Good morning.
Thanks for having us.
John, let's start with you if we can. Tell me a bit about the news that came out yesterday about the vaccination rollout this weekend. What's the strategy to start, as you say, getting the needles into people's arms?
Sure. So we've been working with public health, our partners at both Pitkin County Public Health and Community Health. We will be doing 100 vaccines tomorrow. We're really just acting as the boots on the ground. We've put a process in place that we think we're pretty comfortable with how it works. It's worked well for all of the employees that we've done. So we're going to do 100 tomorrow morning. And then we are working with, again, folks at Pitkin County Public Health and Community Health to get plans in place to do not quite 1,200 next week. So we're excited that we're able to get these in the arms and start working on the folks who are top half of phase 1B.
And John, I understand that there's two different vaccines coming in, one from Moderna, one from Pfizer. Can you just tell people about the difference between those? Are they the same? Just kind of allay any worries that people might have between which one they get.
Sure. So the technology behind them are very similar. Probably the biggest difference between the Moderna and the Pfizer vaccines are the time that you have to wait between the first and second dose. So both of them are 2-dose series. For the Pfizer doses, those are 21 days apart. So you get a vaccine on a Monday, 3 weeks later, you'll get your second dose. And for Moderna, it's actually 4 weeks. So again, in the same example, you get it on a Monday, 4 weeks later, you'll be set to get your second dose. Tomorrow we'll actually be administering the Moderna for the 100 people that will receive the vaccine tomorrow. Next week, as we look to roll out again nearly 1,200 doses, those folks will all be receiving the Pfizer doses. So anybody who's scheduled to get their vaccine tomorrow, they'll be automatically scheduled 4 weeks out from tomorrow to get it. And then next week, as we go to get those vaccines into arms, they'll be automatically scheduled to receive their second dose 3 weeks later.
Excellent. And Amy, let's bring you in for a second here. This has been a fraught time for everyone, specifically for healthcare workers and frontline workers. You actually had the honor of giving the first vaccine at the Aspen Valley Hospital. Can you talk about how the mood has potentially shifted with the employees there at the hospital now that the vaccines are being administered?
It has been a palpable shift of hope and excitement. That first day giving the vaccines, I woke up with butterflies in my belly. And I think all of us just recognize that the vaccine is our way out and our way forward from this pandemic. And particularly those who work the front lines and are putting their lives in jeopardy every day. This is a really shift to be able to know that we're going to be safe moving forward.
One of my concerns is that the vaccine is here and it's great news, but that doesn't mean that people can be complacent about their approach to spreading the coronavirus and helping to stem COVID-19. Can you talk about that a little bit, about what people's mindset should be that, yes, this is great news, but we're not all the way through it yet?
Indeed, that has been a big part of our messaging, just even internally to our healthcare workers, that you would assume know that things aren't going to change, but nothing changes for quite a while until we all are immunized. The CDC is recommending that until our country is immunized at a level of about 70%, really change our behavior. So we are reiterating that mask use, social distancing, hand washing, all of the things that we're doing in our 5 commitments doesn't change.
And John, let's go back to you if we can. You mentioned earlier that the first people are starting to get vaccinated this week. Tell me about the logistics of this. What is the process for people registering so they are in the queue to start receiving their vaccinations?
Yep. So Pitkin County Health is handling the registration for all folks in phase 1B. I would reference you out to their website to complete the pre-registration form. But they'll go out to register themselves From there, they will receive an email from the county saying they have been selected, and it's a complete lottery system. Those are folks who they meet the criteria that they're 70 years of age or older. They're randomly selecting the folks who will receive the vaccine tomorrow. So the first 100 people have received notification. They are in the process to sign up. And then very early next week, an email will go out to the folks who were selected for the next, 1,170 doses. You'll go out, you'll enter in a little bit of information online that's required for us to be able to submit the information to a statewide database as the CDC is tracking all of this information because they want to know who's receiving these vaccines. And then as far as the logistics go, you'll have a time frame. We're scheduling 5 people every 15 minutes, and you'll be directed to where the vaccines are occurring. We'll get a little bit more information tomorrow. You'll move to the next step where folks like Amy and our other vaccinators are getting the shots into the arms. From there, they'll move to an observation area where you'll be observed for about 15 minutes just to watch for some side effects. You'll be given some information, and from there, you'll be moved along in the process and released to go. So again, with us doing the vaccinations for the employees, we've really been able to fine tune this process. So it's easy to work, and it's a really slick process. So we're excited to actually start working on these folks tomorrow.
Excellent. And Amy, you mentioned earlier that this was a collaborative effort with Pitkin County Health. Can you tell us a bit more about the stakeholders that are involved in this process and what you've seen on the front lines with different people from the county and the state and here at the city all coming together to make this happen?
This has been an amazing collaborative effort. John and I have been part of the vaccine task force going back probably to September, October, working with Pitkin County Public Health, Community Health Services, and then John and I representing the hospital. We have meetings at least twice a week and often more than that as we need to fine tune things. And it has really been an amazing team effort. I think we all recognize that we're in the middle of a pandemic, and if we're going to make changes and find our way forward with the vaccine, we've got to work at it together.
Excellent. Well, it is certainly nice to see everyone come together. It's so nice to have finally reached the point when we are receiving vaccines in the community. It's nice to have some positive news to end the week on. Thank you both so much for being here today. Thank you and all of your colleagues for the hard work to this point. And we're excited to see this vaccine roll out this weekend.
Thanks for having us.
Thanks to all of you for joining us here on the Aspen Daily Update. For more information on the vaccine rollout, visit covid19.pitkincounty.com. You can find us at aspendailynews.com and across the social media networks. We'll see you next time.